Hello everyone, welcome back to my channel. So in my last video I spoke about how I was diagnosed with multiple cancers and what happened after that, the chemo and everything else. And in today's video I will be talking about the surgery part of it. On October 19, 2022 I was scheduled for my surgeries, but because my blood counts were very low I was discharged and it was rescheduled to November 9, 2022. Like I said, since my blood count was low, the doctors got really scared and they were thinking that maybe my cancer had spread to my bone marrow. The bone marrow is the part that produces white blood cells, and for a surgery you should at least have 4,000 or more for white blood cells. I was not meeting the criteria at all. Hence, the doctors decided to do a bone marrow test before I go further. I have done a lot of procedures in my life, but the bone marrow test was one of the worst ones ever. I never screamed that much in any procedure. Even after my surgery, I did not endure that much pain like I did during that bone marrow test. It is inhuman. I don't understand why would they do that when someone is awake. I think there's a reason, but then it is really painful. So what they do is they only do it with local anesthesia. Now the local anesthesia, as according to me, was only on the surface of the skin. When they were pricking it I didn't feel anything, but when they went down my bone and when they drilled it down there, I could feel everything. When they were drawing out the bone marrow, I could feel that tension that it was coming out. Oh Lord. Still I was cooperating, but I was screaming. I screamed. I remember after the test, I also apologized to the doctor for screaming so much. I was like, I'm so sorry. After the bone marrow test, my results came and it was not bad. It wasn't bad because I did not have cancer in my bone marrow, yay me. But I did have something called autoimmune neutropenia, which means that my immune system was compromised. Obviously, I had so many rounds of chemo that my immune system was compromised. It had to be. So what that means is that my immune system was mistakenly attacking my white blood cells. Basically my immune system was against me instead of fighting for me. Excessive chemo can do that to your body. So I was on a high dose of steroids, so my face was swollen like a potato. So after the steroids, they tested again and my blood cells were normal again, but then they wanted to wait for another week for it to recover on its own, not because of the steroids. Then after that they waited for another week, and after schedule, that was on 9th November 2022. Okay, so during the time that it was rescheduled, I was really second guessing the surgery or getting really scared. I went ahead and asked my surgeon that if living with the tumor was better than taking it off because it has a lot of risk. Feel like we should never feel shy or embarrassed to ask questions that is in your head, because it's about your body. A lot of changes are gonna happen after that, and so whatever questions you have, unless they are extremely stupid, you should ask your doctors and make sure that you know everything about what's gonna happen to you. Anyway, so I did ask that to my doctor and she said I have to take out the tumor. So the complications of the surgeries were many. Some were like very common complications, but the one which was really in my head for longest time was that I was in danger of losing a limb. So basically the tumor was on the left side of my abdomen, and as a child I had bone tumor on my left leg. Since the tumor was behind all the blood vessels, they had to cut off the blood vessels, take out the tumor, reconstruct the blood vessels. So that could compromise my leg, which is already compromised with bone surgery. I had a whole bone replacement surgeries, and if the blood flow didn't go well and something goes wrong, I could lose this leg completely. And that was something that I was not ready for. I was like, I don't want to live this new life of not having a leg. I was already walking with a crutch and that was difficult on its own. At this point I have accepted this life and I didn't want this to change. I was really scared, and that is the reason why I was second guessing the surgery. I hate waiting. Even in my chemo session, sometimes it gets delayed due to my lower blood counts, or if my hemoglobin is not meeting the criteria for chemo and all of that. So when it gets delayed, I get really annoyed because I just want things to just finish off. I just want this phase to get over with. I get so irritated when I have to wait. So when my surgery was postponed, I was annoyed. I was so frustrated, and I did not like that time, that waiting time, that I had to wait for so long for me to get answers, like if I am ready for surgery or not, or this and that. It was traumatizing. So that part made me more frustrated and scared. But then when the surgery was actually scheduled on the 9th of November, on the 8th of November when I was admitted, I was so chill. I did not care anymore. I was so calm. I think in a way I was calm for my mom and my sister, because I just thought that the doctors already told me that this surgery is going to take time. So I was thinking that if I go with a sad face, they will always remember that sad face, and then they will be sad the entire time. It was already hard for them to wait outside the operation theater and not knowing what is going on inside. If I was not happy and I was not showing that, that I was okay with it, I think it would have been harder for them. I think in a way I did it for them, but I did not know at that point. But then I was dancing. Look at me. This is me dancing the night before my surgery. Yes, so I was pretty calm and I was laughing. I was making jokes. I was making some really dark jokes and everything. And it was nice. And the morning of the day of my surgery, I was smiling. Even when were they taking me, I was like, bye. Look at that. So I wasn't scared at that day. I don't know why. But I just had faith in my doctors. I believed in them completely, and I just do what you want. Just fix me. I don't know what happened inside the operation theater. This year, when I completed 1 year of my surgery, there is this doctor who was present inside the operation theater. He wrote one letter for me which explained everything what happened inside. I will post it here. Yeah, if you have the time to read it, then please do. If not, then let me explain you in brief what happened. What happened was that first they did my breast conservative surgery, also known as lumpectomy. So lumpectomy means that they only will take out the lump and not your entire breast. So that's what I chose. I could have gone for mastectomy, but then I did not want. That was a personal choice, but sometimes when you really need to, you should do it. I think you should really consult your doctors and talk to them like what is best for you. And since I was already having one major surgery in my abdomen, I did not want to go for another major surgery in my breast. And my doctors also thought that was a better idea. So listen, the risk of cancer coming back in mastectomy or in lumpectomy is almost the same. Maybe the risk is higher when you conserve your breast. I think that for me the risk is always there since I have a genetic condition, so why not just preserve what I can. So that's why I chose that instead of mastectomy. After that, after they removed the lump from my breast and some lymph nodes from my axilla, that is my armpit, for biopsy, so that they can check that if my breast cancer has spread to my lymph nodes or not. But it didn't. The abdomen surgery was a bit too tricky. So what they did was they cut me open. Then the vascular surgeon came in. They chopped off the blood vessels and clipped them. And then the main surgeon took out the tumor that was inside, and then the vascular surgeon enters again and they reconstruct the blood vessels using a tube-like material which they connect to the blood vessels for the blood to flow through that tube. So that was the tricky part, and it's a very difficult surgery. I did ask the nurses before going to the surgery, do these kind of surgeries happen more often here? But it's like, no, this is pretty rare. I was like, okay, that didn't help. Then after they did that reconstruction, then they checked if the blood flow was good. It was all good and everything was fine. So basically I had 3 kind of surgeries in a day. One was major, one was almost major, and one was pretty minor. So yeah, after that, this whole surgery process took 12 hours. It started at 7:30 a.m. in the morning, it ended 7:30 p.m. in the evening. So it took 12 hours. So forget my surgery, I was only thinking after like 12 hours, how did my mom and my sister just wait outside? Imagine how worried they were, like not knowing what's going on inside, you know. And I would get so anxious, and I'm sure they did too, but then they somehow put themselves together for me, and I'm really proud of them. So yeah, after I was taken out in the waiting room and they were waking me up, I remember one thing, that the moment I woke up, I was wiggling my toes just to see that I do have my legs or not. And I did, and I was really happy. And after that, I dozed off again. And then they took me to the ward. Okay, this is me after surgery, unconscious but slaying. Okay, let me take a second to appreciate my surgeon. The cut she made on my abdomen is so straight and precise. I am impressed, and it doesn't look bad. See, it looks like I have abs. It is so straight, it's so nice. Okay, so the person who attended me was my sister, because she can sleep through anything, and once she's woken up she can go back to sleep again. But my mom is a light sleeper, and my sister did not want my mom to be awake the whole day. She'll get weak, then who will take care of me? That was the whole part. But my sister took on the job like a pro. Everyone in the hospital thought that she was my elder sister, because the way she was taking care of me. And I know there were times that I get so irritated, like I would be shouting at her. And I will admit that there were days that I was more irritated than the other days. I would be like yelling at her, but she never took it in her heart. She always took care of me. And after I felt better, we also had some fun. We sang, we laughed. There she is, my attendant, doing my attendant work. And yeah, I am really blessed to have them in my life. I'm really proud of them, both my mom and my sister. They're so strong. Even seeing me in such a bad situation, they did not break, and instead they were lifting me up. And I'm really glad that I have them in my life. You know what? The epidural that they gave me after my surgery, it was only working on the upper part of my abdomen and not on my pelvic region. The surgery started right from under my chest up to my pelvic region, so it was not working at all. And any painkiller that they gave me, tramadol, nothing worked on me, because as I told you in my last video, I was taking pills for past 5 years and I was not responding well to any painkillers. So then they resorted to give me something that was inserted in my veins, and it had a button, and I could just press the button whenever I felt like severe pain. But I was not using the button more often than I should have, because I was just bearing the pain, because somewhere in my head I was scared to get addicted to drugs, you know, because that was a very strong one. I don't know what was it, but then I was given morphine, I was given so many things, but I used to avoid taking medicines so much because I am really scared of getting addicted. And as addiction is in the family, I did not want to do that. I really was just bearing it all throughout. I think I used it almost like 3 to 4 times, not more than that. And even the doctors were like, why are you not using it? It's like, I don't want to. And then my ambulation started. That means the recovery journey. Ambulation means walking, start to walk after the surgery. Ambulation is very important after surgery. I had all the pipes in my body, but I still had to work because I wanted to get discharged as soon as possible. Though after getting discharged, I was missing my nurses and my doctors because I used to love the conversations I used to have with them. And then yeah, I walked pretty fast after my surgery and I was recovering well. And I started sitting up by myself. And then when I was about to get discharged, my sister had to leave and she had to come back to Shillong. And then my aunt came and I thought I was getting discharged, but then I had to stay for 2 more days because I suddenly had pain in my toes. So the doctors had to keep me under observation. They were pretty scared that day. They were thinking that my blood flow was not flowing, but then it was. All the tests were done. And then after 2 days I was discharged. Okay, my aunt also really was there for me. Okay, I'm really lucky with people though. And after that I went home with the pain patch, but that patch was not working. When they put on the patch, I was asking the nurse, when will it start working? It's like, it should start working by now. It's like, it's not working. And then I went home, it was still not working, nothing was happening. I still had severe pain all over the place. Obviously I had a big surgery and there was like nerve damages and all of that, so obviously the pain has to come with it. I was in a lot of pain, and after that I couldn't take it anymore. I was frustrated, it was so painful, and then I was sent for palliative care. The pain was unbearable because I also had to start radiation soon. They had to make me recover fast. So after that I was recovered and I started walking on my own a little bit, and everything was fine. I used to do those post-surgery exercises for my breast and also walking most of the time. I tried to do everything. I was a bit lazy for the exercise, I will not lie. After that I was sent to the radiology oncology department for preparing me for my radiation. In the next video I will tell you all about my radiation and when it started, how many rounds I got, and everything else in between. Thank you for watching, and if you want to know more about my story, do subscribe to my channel. Let's empower each other to overcome any obstacles and live our best lives while we can. See you in the next video. Bye.